today, I thought about kind of the things that I wish my patients would have known coming in. And so really, we'll talk a little bit about different types of headaches because, as you may know, it's rarely just one thing, right? Like Chiari and Syringomyelia and all of this is just part of a bigger picture. And so really being able to know what kinds of headaches you have or your loved one has is going to be super beneficial to you because they're going to have different treatments. And then if you get referred to a neurologist, what are we looking for? What are we thinking about? So just kind of walking you through a little bit of how I think about patients when I see them. And then understanding that big picture of what are all the things, all the things that make headaches better and make headaches worse. And then learning really how to advocate for yourself. I would love to say that you can show up in my office and I can give you the magic pill and you'll go away and never have another headache, but that's just really not the reality at all. A lot of what we talk about is in headache land, our big job as neurologists is to be your co-pilot. It's just similar to if you've ever taught a child how to drive, right? Whether it's a bike or a car, you can't do it for them. You wish you could protect them from all the things, but you really just have to scaffold them and teach them how to do it themselves. And so that's really what our goal is in neurology. And even for you as an adult, that should be your feeling with your neurologist, is that they are helping you figure it out and giving you the tools to do it yourself. So as is the case in pediatrics, a lot of the medications we use aren't officially FDA approved. Not that they're not safe or not widely used. It's just that the research isn't always there. So I like to think of headaches in, is it the brain itself or is it something that's happening to the brain? And so headaches that are the brain itself are your primary headaches. It's just genetic, how you're put together. Not that Chiari isn't genetic in how you're put together, but it's just a little bit different. So it's the first thing I'm going to think about when I get a headache patient who has that diagnosis is, are these Chiari headaches, migraines, tension type headaches, musculoskeletal headaches, or is it all of the above? And usually the answer is it's all of the above. So there's, like I said, migraine, tension, and then musculoskeletal headaches. So I know you've had a headache lecture yesterday if you went. Migraine, this is how I teach the med students. If you can count to 5, you can diagnose migraine, okay? So you have to have a pattern of at least 5 headaches because your first bad headache isn't migraine until you've proven a pattern. A migraine is just a way to describe a bad headache. You could have a migraine that technically meets these criteria, but it's due from a brain tumor, okay? So there's always a caveat at the end that it's not due to something else, and that's where you go to the neurologist for. So a pattern of 5 headaches that doesn't go away on its own. So adult criteria is that it lasts 4 hours to 3 days if it's not treated. In kids, it's 2. Is it not a migraine after 3 days? No, it's just status migrainosis episode where you're probably going to need IV medication to get rid of it. And then the 2 is the headache itself has to have certain features. In my mind, the one must feature is if you let it build on its own, it is going to be moderate to severe. How do you tell if a 4-year-old has a moderate to severe headache? If you've ever seen a 4-year-old, if they were sitting on the couch without the TV in the middle of the day while everyone else is playing, you know that's a big deal, right? They're not going to voluntarily take themselves out of commission. Unilateral means one-sided. I would say that's more common in adults than kids. Kids often have both sides of the head involved. Still, meaning it makes you not want to move because it hurts more to move. And then throbbing. It's usually more of a pulsating pain than just a constant squeezing pain. So again, you only need 2 of those features. And then it's not just the headache, it's the headache and nausea and vomiting and light sensitivity. So that's migraine. People who have migraine don't just have migraine, they often have other headache types as well. And so the way that I think about the second primary headache type, or headache that is kind of how your brain is put together, is a tension type headache. This is what people think of as stress headache. So it's everything that migraine is not. It's mild to moderate. It doesn't matter. You could walk around, do your job, and do all the things with your headache. It might not be fun, but it's not going to exacerbate it. It's not really pounding, it just is squeezing on both sides. And then you can be a little light or sound sensitive, but you're not usually both. Now, of course, a tension type headache can lead into a migraine, right? So sometimes it gets a little confusing when you're trying to think about it. So this is one of my patients that I had that was coming to me from neurosurgery talking about, well, what kind of headaches do you have? And so kind of alludes to this question about weightlifting in the back. So I saw a teenager who was very into fitness and really loved weightlifting. And he started having pain at the back of his head when he was doing this. And it mostly happened when he was lifting weights, but he just kept lifting because, right, no pain, no gain, no big deal. He really had never had a history of injury, and suddenly he started to realize that he was not able to deadlift as much. His weights were going down, and actually, when people were spotting him, he would have a moment of just weakness where he would drop it and decided he'd probably better go get it checked out. And so lo and behold, he had a pretty big Chiari, and he wound up needing to get surgery because he was having that, like we talked about before, Valsalva-induced compression that was causing issue to the point where he actually had weakness just in his arms on a daily basis. And so we told him, please don't weight lift. This is not no pain, no gain. This is not good for you. Let's wait. And so I think for me, one of the big things when I'm thinking about headaches is really how many kinds of headaches do you have? And then for each one, what does it feel like? Where does it hurt? When does it happen? Because if we're talking about migraine and tension type headache, those should be in the front half of your head. That's the nerve that's supplying that, this trigeminal nerve area. If you have headaches that are starting in the back of your head, that should be a red flag for whoever's treating you that that's not a migraine. That might start a migraine later, but that's something else. So back of the head headache is always, what is it? Is it a Chiari malformation? Is it in Valsalva induced? So we'll say, what happens if do you get a new headache when you're laughing, when you're coughing, when you're going to the bathroom, when you're weightlifting? Not that if I had a migraine and did those things, it wouldn't hurt more. Of course it would, but it's not going to cause me to have a headache. The other really common one that I feel like maybe not a lot of providers learned, now that we all focus on our devices, I think if everybody just pays attention to how they're standing right now, you might notice they're kind of hunched forward or not up like this, because it feels really weird because we don't do this. But this is leading to a huge epidemic of neck and back pain and headaches. In fact, in general, neck pain of all causes is number 8 in the WHO's global burden of disease as far as most years lived with disability for kids and teens, which is higher than things like asthma, alcohol use, drug use, road injury. And if you think about it, right, everything at school is on a device, whether it's a Chromebook or they're looking at their phone or they're taking a test. And so the kids are spending 5 to 7 hours a day hunched over doing things. And really what that leads to is a whole bunch of extra stress on your upper neck and the muscles that are holding your upper neck together. So in this little cartoon, it talks about if you were standing upright, you have about 5 kilograms of force, but just bending forward at 30 degrees puts 18 kilos of force on your neck. 60 degrees is 27. So that is a lot of extra work you're making these muscles do. And that, again, that can be kind of hard to figure out, which is it? And honestly, it's probably both. Everybody's on devices. And so that's one of the things that we look at when we're seeing patients. Okay, yes, you have back of the head headaches. You have a Chiari. But do you also have tech neck or text neck? So limit screen time, right? Haha, good luck with that. It's also really hard to make yourself sit upright. And so usually it's a lot of education and re-education. I would say it's so much easier to get a kid out of this cycle than it is to get an adult out of this cycle, because I don't know about you, but we're kind of set in our ways, and there's just that many more years of muscle memory. So usually what I'll do is simple as just pushing on the back of somebody's head in clinic from behind the ear all the way to the middle. And if they jump off the table and they're like, that hurts, or, oh, yep, that's where my headache is, it's usually from the back of the neck kind of coming forward like little horns, because that's the distribution of that nerve at the back of your head. And so that, and then just seeing what their range of motion is. Can they go all the way up and down, or do they get stuck to the side and realize that something's pulling, or even just pushing on the trapezius muscles? They're really tight. Sometimes I like to play the game of, oh, you're left-handed, right? How'd you know? Well, because you were saying like this. So anything that gets them back into a proper posture and keeps them there is great, which is why I think in general, in Chiari and all the associated conditions that come with it, whether it's Ehlers-Danlos or chronic pain syndromes, that's why having the right kind of daily exercise plan or just weekly exercise plan that you can do and do safely and keep yourself strong is really going to help. I will often send people to physical therapy with a physical therapist who specializes in head, neck, and spine to get them to do posture re-education, because you got to teach these muscles that are deep inside your neck to take over the job that your traps have been doing for so long that they shouldn't actually be doing. So anything that gets that right balance of muscles put back together is helpful. The other thing we have is just a handout on how should we actually be sitting. So you can do this at work too. You can get an ergonomics consult at most places, or just Google it. What's proper sitting posture? Because I bet most of us don't sit that way. And so there are things that you can do to set yourself up for success and to put a little bit less strain on your back and neck. And then there's also different medications or interventions or therapies that you can do to help release the tension in those muscles. Anything from actual numbing medication injections to dry needling, which is not acupuncture, but it's aimed at the muscle belly itself. It kind of helps it relax and lets you rehab a relaxed muscle versus trying to rehab a really tight ball. And then, pain nerves are real strong, but they're not real smart. So if you put hot or cold on something, right, you sprain your ankle, you put an ice pack on, it temporarily feels better. And the reason that it does so is because the nerves that carry pain also carry temperature sensation, and you're just jamming traffic. So there's a lot of different ways you can help reduce that traffic flow of pain signaling to your brain. One of the ones that I briefly mentioned is trigger point injections. You can go and see an anesthesiologist or a headache provider who can numb it up for a while. And then also, if it's really tight and you're struggling to sleep, or physical therapy is really a lot of extra pain while you're waiting for your gain, you can use a little bit of a muscle relaxer on occasion. In some protocols, actually, for things like fibromyalgia, you can put somebody on a small amount of cyclobenzaprine or a muscle relaxer every night just to help quiet it down. The downsides of those is muscle relaxers can make you sleepy, dry mouth, that sort of thing. But I've definitely seen it help in the short term. So when I was talking about trigger point injections and pushing on the head, this is what I'm talking about. In this cartoon, those little yellow guys are the occipital nerves. So they go through the muscles and up the back of the head. And so that's usually the distribution of this pain is coming forward. Okay, so we know there's lots of headache types. You might have a bunch of them. You figured it out. You have a mix of, migraine and tech neck. All right, great, grand. I know which one is which. What do I do about it, right? Well, like I said, I wish I could just give you a medication. It would all go away, but it takes a little bit more than that. The way that I think about it and the way that our headache clinic approaches it is really the basis of headache and pain is prevention and just being nice to yourself and taking care of yourself, which sounds very glib, but we'll go through it. And then there's your as-needed medications. When you get a bad migraine, for the love, treat it right away. Don't hang around and torture yourself. But then again, some of these other tension type headaches or musculoskeletal headaches, you have to treat them in a little bit different approach. And then if we need it, you can do a daily headache medication. Is it going to fix things right away or for sure? No, but it can absolutely be part of your headache regimen. So how do we talk about this? I think a lot of what we talk about in a headache clinic isn't rocket science. I think the luxury is just that in subspecialties we get time and we get that time to talk to families and see what's going to work for them. So the main things that I try to get across is this isn't your fault. This is how your body and brain were put together. It is real pain. And it's just a part of who you are. And we don't want to let it define you, but it is what it is. And when we talk about not Chiari pain, so when we're talking about migraine pain, tension type headache, and a little bit of this tech neck pain, it's nonsense pain, right? It should not hurt to push on a nerve. Well, it hurts a little, but not that much. It's brain learning. And so I will typically tell the kids, pain is supposed to have a purpose. Like you break your leg hurts. Yep, okay, don't walk on it. Get a cast. Leg heals. Now your pain's gone. That's what the point is. But in people who have chronic pain or migraines, it's more than that. Our brains are learning machines. Yay, brains don't pick what they learn. They just learn. So migraine brains and headache pains overlearn pain. And so they just perpetuate it and get you to the point where something that shouldn't be painful is painful, like touching that nerve really lightly. So what do we do about it? My goal is for you to be able to manage it, right? We talked about you really have to have that sense of agency of I can do this. Obviously, that's going to look really different for a 4-year-old versus a 16-year-old. But as soon as the kid is willing and able to talk to me, that's who I'm focused on. I'm teaching their parents as well, obviously. But I want them to be able to use the words and speak up for themselves, raise their hand in the middle of class and say, I have a headache, I need to take care of it. I don't want them to be told, oh, it's fine, wait till the end of the day, because then, that just really defeats the purpose. So I think that's the biggest thing for you is that if you're dealing with headaches, you really need to feel like you have that partnership with your neurologist or your primary care physician, because it isn't as simple as, here's your meds, bye. It should be a discussion, or at least if they don't have the hour to talk to you with a discussion, where can I go to find these things on my own? And, it's going to be different. There are days where I have zero motivation. I just come home from work and lay on the couch. I know I should cook a good dinner or work out or go finish those emails, but am I going to? No, because I'm done. And so I think if you keep a little bit of that in the back of your mind, that helps you see how, yes, there's all these things we can do, but it's not easy. But that is how I think about it, right? So it's all the things. It's all the things we all know we need to do, but it's a balance. So the 5 big things we talk about every time I meet with the kids, we do a quiz and see, what can you do? All right, what are the 5 big things that help us keep our headaches away? Sleep, exercise, eating healthy, drinking lots of water, mental wellness, so being able to handle the things that life throws at you, and then monitoring sneaky things like caffeine use. So this is where I think education is key, because a lot of people don't know this stuff. Like, how much sleep does a kid actually need? A common answer I'll get is 8 hours. But that's really not true. Sleep is when our brains assimilate what we learned during the day. The first thing our brains process is emotional regulation, and then long-term memory. It's when your body kicks out growth hormone for you to grow. And kids are doing so much of this every day. They need much more sleep than adults do. And so, an infant can sleep 12 to 16 hours. Even teens usually need more than 8 hours of sleep because they are still growing and developing. And that's really not easy in today's society of hustle culture, and I have to be the best in my soccer practices until 10 at night. I think if I could have one soapbox in this city, it would be, why are you scheduling games and practices at 10 at night? But anyway, I don't have that much power. So what kind of exercise? I mean, it's got to be something that you enjoy and that you'll do. It can be good enough. It doesn't have to be perfect. In kid world, play is exercise. So they recommend 2 hours or less of screen time a day, really just meaning kids should be kids and play and interact with the world. And they recommend about an hour of play a day, which I feel like most school-age kids get. Safe things, swimming, maybe yoga if you're not too hypermobile and if you can pay attention to what you're doing, but things that strengthen the upper body and your core. And then what other kind of exercise can we do? Brain exercises. This is a huge one. I like to talk to kids about how our brains are learning machines and muscles, so to speak, just like anything else. So you absolutely can train your brain. I believe that there is a talk later this afternoon or this morning about the psychology of pain, and I assume that they'll get into this a little bit, but of all the things that actually have research-proven evidence for pain control, it's this. And so even if you don't have pain, I think this should be a universal life skill that is taught in schools, because this is the idea of how do I handle my emotions when I'm in pain, when my teacher is annoying, when my sister yells at me, when something is stressful, when something is exciting. Because your own emotional overlay to the pain that's there could make it way better or way worse. And so you got to strengthen both sides. If you have chronic pain, your pain side of your brain is already overly strong, and your calming side of your brain is a little bit weaker. So if you can strengthen those calming skills when you're not in these dire situations, then when you are, it will be much better. And kids who did cognitive behavioral therapy plus daily medications got better faster and stayed better over the long haul compared to kids who only had the medication, just because you're learning new life skills. There's plenty of ways to do this. There's apps, there's workbooks, you can do in-person training. If kids are younger, there's actually parent training. And so more in the realm of anxiety or kind of worry about some of these things, there's this program called SPACE, which is supportive parenting for anxious childhood emotions that the university does, and I believe is a nationwide thing, because you're with your kids most of the time. And so if you can learn how to teach them to respond to those things, then it will get better, because not every kid is going to be willing to go do a workbook or sit in front of somebody and learn these things themselves. So whatever it is, it doesn't have to be a workbook. It can be, as my husband calls it, he calls hunting his meditation, because 9/10 of it is just sitting in nature, right? Listening to bird songs. It's green space, it's blue space, it's fishing, it's praying, it's whatever you do that calms you. But you got to do it. Food. How is food medication? So one of the ways I think about chronic pain is that maybe a little bit of this is that your body's batteries drain faster than other people's. And there are certain things that your body's batteries, called the mitochondria, need to function well. And those are found in a variety of colorful foods. So there's no fancy headache diet other than healthy eating. The things that I think about are, don't let your battery drain too quickly. You got to keep fueling it. So intermittent fasting might be okay for some people, but I don't usually find that it works very well for people with chronic pain. They really need to have some amount of food about every 3 to 4 hours while they're awake. And when they eat it, it needs to be a mix of all the energy sources, right? Your brain needs fat to think and to develop. Your brain is literally coating itself. The nerves are coating itself with a fat-based thing called myelin throughout childhood. And so it needs to be a fat, protein, and carb. So in the morning, a Pop-Tart, that's not going to help, right? And so really trying to find little foods that are useful that have those categories in them. And then making sure that you're getting good fruits and vegetables, calcium, yes, there are headache triggers that are specific foods, but in kids, I find that this is so hard to figure out, whether it's dairy or preservatives or nitrites or red wine or aged cheeses. So I don't usually focus a lot on that unless people kind of flag for some of those. How much water do you need? So there's this little rule that is not super scientific, so take it with a grain of salt, but your age in years is cups and ounces through 1 through 8. So if you're 1 year old, you need about 8 ounces of water. If you're 8 years old and older, it's about 8 cups of water. And so that is something that I talk about a lot, is from the moment that you wake up and go to school, that school is your biggest battery drainer. You're thinking you're having to be in a loud environment, a bright environment. People are annoying. Tests are stressful. You can't control that. What can you control? You can control your water intake. You can control what you eat for breakfast. And so try and drink enough water so that your urine is light yellow to clear and you know your body's kicking it out, but do it throughout the day. Don't save it all to the end of the day. One thing that I think marketing really does for kids is makes them all want to drink energy drinks. Every time I have teenagers and they're telling me about this new one, I think the most popular one now is Alani, and everybody wants to try it. Which, I mean, just like everything else, you know, it's not that caffeine is inherently evil in itself. It's just how much are you using it? Caffeine is a drug to your body. Okay, so there are actual guidelines from the American Academy of Pediatrics that say once you're 12 to 18, a little bit of caffeine's okay, but a little bit should be less than 100 milligrams a day, which is about equivalent to a cup of coffee, 1 to 2 cups of tea, or 2 to 3 cans of soda. I am not saying that your children should drink 2 to 3 cans of soda a day. That's not the point. But kids less than 12 really shouldn't use it. I mean, who wants to give your already active child extra caffeine? It just sounds like self-torture to me. So why? What's the point? You might have heard in the past that there's the video gaming YouTubers who legitimately like $1 million playing video games. And they do this by doing marathon sessions. How do they stay awake? 3 Monster energy drinks. They've died doing that. Not that everybody who has 3 Monster energies in a day is going to die. But if you already have a heart rhythm problem and you don't know it, that's going to put you into it. And so these are just things that people aren't going to know until it's too late. Plus, if you get used to caffeine and you skip a day, you're going to get bad headaches. And let me tell you, withdrawing from caffeine is no fun, and you're going to have a wicked headache for about 10 days to 2 weeks. So I really wish kids wouldn't drink Monster energy drinks or Alani or any of them. Or if they just have to, then I say, well, can you buy the little ones? Can you pour half of it out and just drink half of it? Because they have a 24-ounce Monster has 240 milligrams of caffeine in it. And that's more than twice what's recommended. So what do you do with all these things? Because nobody's perfect. You don't have to be perfect. But what I want the kid to learn, or anybody, honestly, to learn, is how far can I push myself without tipping over the edge? We all know what that feels like, right? And so you have to balance your battery drainers and your battery givers. What are your battery drainers? Dehydration, not eating, hot weather changes, allergies, food triggers, too much caffeine, being stressed, all the things, right? All the things that we know we should do to care for ourselves. So usually what I'll do is try to hook it to something that kids know about. So baseball and softball, how many strikes till you're out? 3. Okay, so if you have a headache, think about the last 24 hours. What battery drainers were there? Oh, you know what? I have a test on Friday, and I'm in the middle of baseball season, and I've been really busy, and so I didn't have time to study, so I crammed last night, stayed up late, and then woke up late. Didn't have time to eat breakfast and forgot my water bottle. So stress, lack of sleep. This is more than 3 strikes. This is 4. Definite guarantee to have a headache, but just thinking back through, because it's never just one thing. That'd be too easy, right? Okay. The awkward Yeti is really funny. If you've never seen these little cartoons on this side. Medications, what do? So if we have a fire, we don't stand there and hope it goes away. We get rid of it right away. This is how I think about migraine pain. As soon as you feel the headache pain, you stop and you go, oh, you know what? It's 10 o'clock and I didn't eat breakfast this morning. Okay, breakfast and water. Okay, 30 minutes later, I'm done. 30 minutes later, nope, taking my medication. And then after that, taking my next medication. So you don't wait it out. But you can do too much of this. And I think this is one thing people forget to tell you, is that if you're needing to treat more than 10 headaches a month, you're going to run the risk of getting into a medication overuse, a rebound headache, where the medication starts to cause your headache because it's gotten so used to it that it needs it, just like caffeine. So if you find yourself reaching for several months in a row for over-the-counter meds or your prescription meds at least twice a week or more, you probably need a new game plan. It can be a daily headache medication. I tell the kids that it's like a Band-Aid, putting a Band-Aid on your brain while things quiet down and we figure it out, and then we hope to take the Band-Aid away when we don't need it. I don't want kids to have to rely on a medication, but sometimes it can be really hard to convince type A people to not do all the things. And there are over-the-counter nutraceuticals, like we call them, or things that help our brain batteries, our mitochondria, to function that you can take for headache prevention that are pretty safe. Things like magnesium, coenzyme Q10, and vitamin B6. It can take a good 8 weeks for any of these to work. And so you have to think about, just slowly introducing it and writing it out. Obviously, if you have side effects that make it not worth it, you quit then. But you got to give it time. And that's important for it to work, but also important for getting to the bigger medications. So for migraine, there's tons of as-needed medications out there to use when you have a headache. There's actually new, really great anti-migraine medications out there that are approved for adults and are finishing up and should come to official FDA approval for children this summer. We're already using them in the headache clinic. We've gotten a process where a lot of these anti-CGRPs we've been able to get approved for older teenagers, but it should be more widely available pretty soon. There's even Botox for chronic migraines. So this is quieting down that pain traffic with every 3-month injections. And we do this for children as well. If they've, have 15 or more headache days a month, 8 of which are migraine for several months in a row, they've tried at least 2 to 3 preventative medications and nothing's working. There's even pain traffic jammers or neuromodulation devices. So the one that is probably easiest to get is this one over here, the Nerivio. It's FDA cleared for 8 and up. You don't have an approval for a device because it doesn't go in your body, and so there's a little bit less risk involved. And this can be used for headache, for migraine prevention, and for migraine when you get one. I really, really like this website called Migraine at School. Even if you don't have migraines, it's just good for headaches in general. There is also a Migraine at Work. It's got great things to advocate for the provider, for the primary care, for the school nurse, for the kid themselves, for the family. That's probably the one I give patients the most. And then for providers, the American Migraine Foundation has amazing, beautiful one-sheeter handouts that you can print in color and go to reference for all the things. The Child Neurology Foundation also has a pretty good headache website. And then this is just a picture of the American Migraine Foundation handouts. And for primary care, right, not everybody has access to a pediatric neurologist. And that's okay, and neurology knows that. And so there are tons of programs aimed at primary care providers, everything from a how-to roadmap for treating adult headaches, pediatric headaches. There's opportunities for you to get CME credit for different lectures that are given.
You talked about the different types of headaches. Do you have any advice for children and adults if they know that they experience different types of headaches to be able to determine what type of headache they're experiencing in the moment?
So I would say keeping track of the pain. You don't necessarily have to do it in the moment, but maybe the day after or once it's better, focusing on what it feels like, where it started, what made it worse. There's apps for that. So there's also paper diaries for that, just for headache journals. But if you're very curious and science-minded on your own, you can actually look it up yourself. So there's this thing that I jokingly call the Headache Bible, but it's the International Classification of Headache Disorders, so ICHD-3 version. I used to do this when I was a brand new baby doctor, and I'd pull it up in clinic and be like, all right, let's see, do you fit the migraine criteria? Because I didn't want to mess up, and I didn't have them memorized yet. And you can look through and see, oh, yep, I meet all those characteristics, or nope, that's not it. With the caveat that there's lots of things to go in that. But yeah, I think keeping track of them, it doesn't have to be literally every one, but for, headache type A, this is what I feel like. Headache type B, this is what I feel like. And then taking that to your provider and saying, what kinds of headaches are these? And then re-educating too, because after people have been in pain so long, I often find that people tell me, I only have 3 migraines a month. And I'm like, okay, pause. What's a migraine? And we go through the 5 criteria, and they're like, oh, I've only been calling my really bad migraines. My tension headaches are actually migraines because they stop me in my tracks. And so reorienting people to what's actually a migraine is helpful.
That's good to know. Thank you.